Today I want to talk about migraine headaches. Millions of people suffer with headaches and or migraine headaches, and it has been amazing to me how many patients I've seen over the years who've tried everything for their entire lives and still have found no help. I decided to do a little bit of research in this regard of recent treatments, and I looked pretty exhaustively on the internet, online, as to what different organizations say about migraine headaches. I was really amazed at how little attention was paid to the possibility of the neck, the cervical spine, being a potential cause and treatment of these types of headaches. I went to the American Migraine Foundation. I went to Mayo Clinic's website. By the way, Mayo Clinic is kind of proud of a new therapy they're talking about called LTC therapy. That stands for Learn to Cope. Then you have WebMD. They have a new therapy called ACT, which literally stands for acceptance and contentment. And they are trying to get people to not control their migraines by trying to grow away from the focus on these migraine headaches. Let me tell you, I'm not trying to be too sarcastic here, but these patients who come in to see me, there's no ignoring the kind of pain that they have and the debilitating effects these migraines have on them. Migraine.com did mention the neck, but they only mentioned the neck in the context of a concussion type of an injury, and more so focused on the fact that the concussion had something to do with the migraines. Now, I'm not saying all these other therapies, all these other ideas about how people can live with their migraines, I'm not saying they're all bad. I'm not saying they come with ill intention. But I am saying that we here at Zehr Chiropractic see on a daily basis patients who come in here with debilitating migraines and what you would call your typical tension headache. We see them every day, and the way we help them is by correcting the problems that are in their neck. So it's really hard for me to swallow when I go through this research and I talk to other people from the medical profession, and the neck isn't given any attention. It's often just kind of passed off as just it can't be, and yet we see it in here every day, not just anecdotally, but in literal results with the type of x-rays that we take that you see behind me, and quite frankly, the results speak for themselves. But let me just say, we focus here at Zehr Chiropractic specifically on the atlas, the first cervical vertebrae, and how it relates to the structural and neurological and vascular structures that absolutely affect migraine headaches, if not solely being the cause. Okay, so now we have Jessica here, who I referred to earlier. And her, I'm going to let her talk, basically. Obviously, I have her here because we're talking about migraine headaches. But Jessica, thanks for being here, first of all. And tell me, what it was that initially brought you into the office.
Well, I was having a lot of headaches. It started in about 6th or 7th grade. I got a headache one day, and the amount of pain I was in would differ, but the headache would remain for months and months, and it wasn't stopping. And we had tried different medications. They weren't working. They would help for like a day or two, and then the headache would come back. And my doctor suggested to try going to the chiropractor.
Okay, very good. Now, you're a senior now, so you said this started when you were 6th grade. So you're a senior, getting ready to go on her senior trip. That's why she's in the office today. She wanted to make sure she was in good shape before she went on her trip to Disney World, right? Yeah. Now, you already just said, a lot of the things that you had tried. Your folks are both physicians, correct? Mm-hmm. Yeah, they both are really good folks, really good doctors with what they do in the medical profession. So you were talking about how you had this headache that lasted for months, but just prior to you coming in. Can you tell me a little bit more about that?
Yeah. So the headache would last for months and months, and the headache wouldn't go away. The amount of pain I would in would just change. And so since 6th grade it was that way? Yeah.
You pretty much had a sustained headache of some sort but the intensity just would increase one way or the other.
Yeah.
And through all that, you were diagnosed with a type of migraine headache as well, right? And so sometimes, were they ever bad enough to where you didn't go to school?
Yeah, sometimes they were.
Yeah, right. Yeah, I mean they'll stop you from doing what you want to do, won't they? Well, what happens now? Would you say? Let's see. You've been coming here about. Has it been more than a year?
I think so.
Roughly more than a year. And is it pretty safe to say that when your atlas is in adjustment, you don't have a headache?
Correct. Yeah.
And when you get a headache, you're pretty close to get on the phone and pretty quick to get on the phone and come in. Thing. Jessica here is an athlete. She's found all kinds of ways to, at times, knock her atlas out of adjustment. And in fact, in one scenario, she changed it. It changed in such a way that we had to change the way we adjusted her. Now, I don't want to get too deep into the specifics of that, but with the atlas orthogonal technique, it's so much more than just grabbing the neck and making an adjustment. It's very precise. The x-rays that you see behind me are used to specifically set the instrument up specific to the vectors of which will best correct Jessica's misalignment in her case. And it happens very rarely, but she was one who actually had an occasion that her atlas did change and her headache started to come back, and it was a little touch and go for a while, but once we got that refigured, now fairly easily now we get her back in adjustment and her headaches are gone, and she's a pretty happy camper, I think, in those scenarios. I asked off camera, I asked Jess what is her favorite thing about this technique or this kind of care.
I said it works.
Yeah.
I can just come in and he'll feel my neck. He knows what's wrong and he can align me again and my headache goes away.
Yeah, does it go away pretty quickly?
Yeah.
Yeah, almost instantly with her. Think about that again. Since 6th grade, she had pretty much a continuous headache, and at times at a status of migraine to which she would even miss school. And again, multiple medications this whole time, and probably saw more than one. Well, it's easy for you to see more than one doctor because you live with 2 of them. But seeing many doctors, I see many patients who've been to the Ann Arbor Head Pain Clinic, to the Diamond Head Pain Clinic in Chicago. They've been to Mayo Clinic. I've seen patients who are on up to 12, 13 medications who have lived and suffered with their migraines. I'm not here to say that all of them are cured, but I will tell you with a rather strong bit of confidence that we help most that come in here. And the fact that it doesn't even get mentioned in the, I guess you could say, the website literature that exists, just is something that led me to want to do this video and let people know that there is another alternative. There is something that can oftentimes take care of their pain without the use of drugs and without any kinds of surgery or even the use of dangerous chemicals like Botox. So again, thanks a lot. Thank you, Jessica. Anything else you want to say?
I think we're good.
Think we're good? No, it's been great having you, and this actually just kind of worked out spontaneously. Appreciate you doing it. Appreciate your folks letting you do it, and thank you out there.